I'd now like to pass to Alice Chapman-Hatchett, who is the president of IFA, and I don't envy her challenge to wrap all of this up and set out how IFA is going to use this going forward. But Alice, I hope we have given you a smorgasbord of ideas, of passion, of ambition, of hopes, of fears for IFA to take and turn into its movement going forward.
Thank you, Tamsin. But before I say anything, I think I've got somebody even bigger than me to hear from first. And I think we're going to hear from Dr. Tedros before me. So can I please ask whoever is in charge of the AV, if we could hear from Dr. Tedros first, please.
Your Excellency, Commissioner Stella Kyriakides, Director General Milka Sokolovic, President Alice Chapman-Hatchett, my Regional Director Hans Kluge, dear colleagues and friends. Congratulations on the 30th anniversary of the European Public Health Alliance. The world has changed dramatically since the European Public Health Alliance was founded in 1993, and even more profoundly since WHO was established 75 years ago. War, climate change, antimicrobial resistance, and rampant inequities pose many challenges, but they also highlight the fundamental role of health in development. Our two organizations share a vision of an inclusive, healthy future where health promotion and disease prevention are prioritized. That's why one of WHO's top priorities is supporting countries to address the root cause of illness through action on the social determinants of health. This goes hand in hand with universal health coverage, built on a foundation of primary health care. The recent Memorandum of Understanding between EPHA and WHO highlights our shared core values of multilateralism, working across sectors, and equity. I thank EPHA for being on the steering committee of WHO Civil Society Commission to accelerate progress in global health. Let us continue deepening our collaboration to strengthen public health and improve people's lives. I thank you.
Now, Tamsin, in answer to your question, that's the hard act. Following that, what a wonderful closing to our event today. What lovely words, and not just words, but actions from the Director General of the WHO. I think that's something to be incredibly proud of. And on that note of pride, dear Milka, dear IFA members, dear IFA family and friends, because that's what we all are. Thank you for such a rich, rich day. Rich on a personal level, seeing so many people here, not pixelated versions of you, but actually real people in a real room. Building so many new professional connections, picking up on old ones. It has been a fantastic, fantastic event. Thank you so much. And it's been both positive and negative in parts. When I think back to the word clouds that we've had up during the course of the day, my goodness me, have they been depressing? They really have. You know, Charlotte, you said run. Yes, out of the door, because my goodness me, they were very negative. But I think that reflects the fact that we are living through really, really turbulent times. Public health has never been an easy ride. But I think more now than I've ever known it in my course of my professional career within public health, I think the people who are passionate about it, who want a better vision of the future, stick in and they don't run for the door. And I'm looking at you all in the audience now today. We're still here. We're here and we keep going forwards. So we are clearly determined in our vision for the future. And it's this determination that we need to hold on to for our next 30 years. Just picking up on the positive elements from today, I've heard some really lovely words, and I'd like to give you my own word cloud from the day, which has picked up on things like learning, knowledge, community, collaboration, partnership, family, solidarity, holding to account, hopeful, telling the truth, values, and translating evidence into stories. And I think it's that positive narrative that we really need to hold on to. I'd like to thank all the speakers, both digitally and those of you who've been with us in person, who have made time in your diaries for today. Above all, I'd like to thank you, Tamsin, for guiding us through it so expertly. What an amazing event. And haven't we been lucky to be able to benefit from such expertise in the room with us today? And isn't it lovely to see Aoife setting the agenda? This feels like a new term back to school, and Aoife's there. And I think we've smashed it today. We really have. It's been fantastic. Behind every fabulous event, there's an equally fabulous conference team. And so I'd like to extend my thanks to all of the Aoife staff that have worked on today, and also the attendees, both online and in person. It's only by engaging, and I think that last session, Tamsin, showed it quite clearly, it's only by engaging your attendees that you know your event has worked, and we've engaged. So tick on that box as well. But I'm here to talk to you more about the fact that this is a birthday party. This is 30 years. And my goodness me, do I feel tall standing here today? Why do I feel tall? Tall because my goodness, how many giants in the room here today. How many giants who have taken us from where we started. And I'm looking particularly at Archie Turnbull and Paul Belcher sitting here with us, where we started from and where we are now, with the Director General of the WHO encouraging us onwards. My goodness me, Paul Archie, did you imagine that? I bet you didn't. So, looking at that, what's that about? That's people. And we've always said Aoife puts the people into public health. And that made me stop and think about all the people that are here and who have led, supported and shaped Aoife over the last 30 years. And I'm afraid I've got a few more thanks in here. I'd particularly like to thank Milka, Paul and Fraser for the content of today. The comms and the conference project management team led by Sasha and Jana, and the whole comms team as well, for putting the content and the practicalities of it together. And behind every event, there's the money that has paid for it. And I spot Agatha's eye in there. So thank you, Agatha, too. Reflecting more widely, not just about today, and over the past 30 years, of which I've been privileged to be a part for 15, I'd like to thank the wider Secretariat going back over those 30 years, current board colleagues, previous board members, Aoife members. I mean, at the end of the day, without Aoife members, there's no Aoife. And it's Aoife members who have made Aoife what it is and have given it the strength, the vision, the passion, all those things that Tamsin was referring to in her closing session. It's Aoife members that have made that happen. Aoife family and friends and Aoife wider alumni. Isn't it lovely that there are so many of you all across the world and you're all connected to this organisation? That is a true accomplishment. You've built and shaped Aoife. And I think the other thing that I'd like to emphasize is the achievements that we've made. And I reached out to a number of people when thinking about this and asked people, you know, what would be your one single achievement that you would like to highlight that Aoife has done over these last 30 years? And some of them ranged from the sort of the very concrete and the practical. Big thing about pharma policy and moving that from DG Enterprise to DG Sanko as it was then. But a lot of them were abstract. And I think it's those abstracts that I'd like to dwell on in a little bit more detail, because I think this tells you what is Aoife and why we are here and why we will be here in the next 30 years. Simply surviving was the top of the list. We're still here. We're still here 30 years from the day that we were founded. And why are we still here? We're still here because we have commitment, we have passion, above all, we have dedication. We really do. We're a meeting place. We're a meeting place of people, of public health priorities, and a meeting place for collaboration to happen, a determination to improve, to put and keep health on the agenda. And that determination breeds a very, very fierce loyalty that carries on once people have left IFA, once people have left their association with IFA. And indeed, there is one of us who shall remain nameless, who would only draw the line at murder for IFA. And I think that speaks to what passion it brings with us when you become part of IFA. We speak truth to power. We challenge credibly. Where we lead, others follow. It has always been thus. It will continue to be thus. So on that note, I'd like to say happy birthday, IFA, to another fabulous 30 years. Ladies and gentlemen, to IFA. Thank you.